So we will get started. Thank you for putting this on, Dr. Fox. Thank you for taking your time to do this. So Dr. Fox is going to talk to us about testing policies, protocol, etc. Surrounding COVID-19. So I am going to go ahead and let you have the floor. Again, if you didn't hear just a minute ago, if you're joining from a desktop, along the bottom you should have a bar. And one of the features there is a little chat feature. It looks like a little message box. Drop questions in there as we go, and we're going to try to address as many as we can during this webinar. And we'll recap at the end for those of you who will wind up watching this as a recording. I'll say this now and I'll say it again at the end. If you're watching this on the recording, you can drop any questions you have to info@uplandhillshealth.org, and we will field them as quickly as we can as well. So this is super important information, and we want to make sure to answer as many questions as we can. Take it away, Dr. Fox.
Okay, thank you. Thanks for helping with the technical parts of this so we could get the information out to people quickly. So the goal of what I'm trying to achieve today is to really just kind of talk through an update of where we're at with testing and what to do with results when we get them back, who should be contact traced, because we're getting a lot of questions, I think, coming through about how does this all work? How should we manage these specific scenarios that come up? So please interrupt if you need to, if there's something that's not clear that I'm saying. I'll share my screen here and launch my, okay, and I'm going to launch my presentation here. Is that looking okay?
Yes.
Okay, so so kind of an update of where we're at right now with testing and contact tracing. And you know, I think most people who will join this already know who I am, but I'll just introduce myself. So I am Sarah Fox. I'm a family doctor in Mineral Point and Dodgeville, and I'm the primary care representative on our COVID incident command team for Upland Hills Health. So I have been working on the testing and outpatient world of COVID-19 since March with a very good team of people. So we've got some updates on kind of where we're at locally with testing and results and what to do with that. Okay, so options at this point for testing is our primarily our drive-up test center, which you can reach through the COVID line, which is through the hospital switchboard, and ask for the COVID nurse, or internally there is that COVID line extension as well. People, if they call the Upland Hills Health clinics with concerns about COVID, we can also schedule them through the clinics. So that's how people kind of get on that schedule. It's not an on-demand test site. It's really needs to be scheduled ahead of time so that we know who's coming. And there is a pre-registration that has to happen with some information on contact info and symptoms and things like that. This test center is for patients who live or work in Iowa County or who have a local PCP. So somebody within our Upland Hills Health family medicine group, or the Dean SSM family medicine group that's located in Dodgeville. The highest priority for this test center, as we're seeing more people who need to get tested, we are trying to make sure that we really get these high priority people tested as readily as we can. So people who are symptomatic, people who are close contacts or household contacts of people with COVID-19, or people who need to be screened for a procedure that they're going to have at Upland Hills Health. The other options for testing, the Upland Hills Health ER, if somebody comes in for ER complaints and they need to be tested, they will test them on site. The Upland Hills Health clinics and SSM clinics that are meant for the respiratory patients, so patients who have symptoms that could be consistent with COVID-19, when they get scheduled for those appointments, if it's deemed necessary, they may have a COVID test at the time of that appointment. And then there are all these community test sites now that are popping up that are helping to offload the numbers of tests to other sites from our drive-up center. So they're listed down there for this week. If people have questions or want to know where they can get tested outside of our drive-up, they can call 211, which is the Wisconsin COVID information hotline. There's a website that I listed there, 211 Wisconsin. And then There's also a website, if you were to search COVID testing Wisconsin, you would get to this link, which is through the Department of Health Services, and that lists all of the community test sites. It also does some pre-registration and kind of walks people through whether they need to get tested, what symptoms they're having, things like that.
Great. I'm just going to interrupt here real quick.
Sure.
So Rosie wants everybody to know as well, adding to that, Spring Green is doing testing Mondays from 11 to 1 at the fire station as well. So we'll see if we can get that added to the chart.
Yeah, so this chart, I'll go back, is primarily was started as a collaboration between Iowa County, Grant County, and Lafayette County. I see they have some Richland Center things on here, but it's not meant to be comprehensive. It really was just what was released by Iowa County for these, Iowa County, Grant County, Lafayette County test sites that are in the next week. So there are many, many other test sites available, and all of them should be listed on that DHS Wisconsin COVID-19 testing website. So if people put in their zip code, it will bring up the local testing sites that are available. And there are more and more every week. So this would certainly not even apply till next week, because there are some National Guard testing sites that are coming up locally to help with some of that burden as well. So so in terms of the results, so when somebody gets tested at one of these sites or at the UHH drive up or the clinics, the drive up, the clinics, and any SSM sites, those results are available in Epic. Those results will be released to the patient's MyChart immediately if the patient has signed up for MyChart. And when they're tested at these sites, they're given information on how to sign up for MyChart. So that's the fastest way for patients to get the results, is if they are signed up for MyChart, it will immediately be released to them. All results, positive or negative, if they're done in the drive-up station or at the UHH respiratory clinic, all those results are called by our clinic staff, positive or negative. So if somebody comes through the drive-through and they say, when should I get my results? As soon as it comes into our in-basket, we have nurses that are working that pool and calling people back. Usually we will get a phone call out to people within about 24 hours of that result coming back. We do have people working it on the weekend. The main thing for people to know is that if they don't get a phone call, if they get tested at one of those sites, they should not just assume that it's negative. They should call to check on the status of that result. Usually within 5 days of the test being done, people should have their results in hand. So if they have not gotten results during that time, they can call to follow up on that. If somebody's tested in the ER, positive results are called by the ER. Negative results are not routinely called. So if somebody gets tested in the ER and they have not heard back, if they have MyChart, they should be able to check that way. Otherwise, they should call their primary provider to look for that result. If testing is done at any one of those community sites that were listed, the results are released to patients either by a text or phone call or through an email. They are not put into Epic. So if somebody gets tested even at our local Iowa County test site, that result will not be viewable in Epic by any one of us. It has to be manually put in if we want it put into Epic. So if you hear of somebody who tests positive and you want to put it in their Epic chart for future information for clinics or things like that, you can contact our Epic team, and they can actually manually put that in, manually put a flag on that person's chart. The reason that we are doing testing and the reason that we are trying to get results out to people is really to try to stop the spread between people who are infected. So if you see this person here, this is somebody who's coughing. This is somebody who has COVID. They expose this person one here. There is up to a 14-day window before that person one could show symptoms if they're going to have symptoms. Typically, it's around day 5 that they start showing symptoms, but it can be up to 14 days. So say this very unlucky person gets coughed on by somebody with COVID. 14 days later, they develop symptoms. So if they didn't know that they were exposed, or they were exposed but thought that they didn't need to quarantine, here we are 14 days later, they get symptoms. 2 days prior to that is when their infectious period starts. So during that infectious period, they then cough on person 2. Person 2 then has a 5-day incubation period before they would start to show symptoms. So this period here between when they start to show symptoms and the 2 days prior. If we can identify these people who are exposed and quarantine them, then they might not infect person 3 down here. So we are really looking at trying to just break this whole cycle by identifying people, certainly when they're symptomatic or even before they're symptomatic in an incubation period, or if they are asymptomatic during that infectious period, so that we can break this cycle and stop these further people from getting infected. So when we talk about who should get tested, number one, people with symptoms. So I don't know if you can see that graphic okay, but the symptoms that are listed, the yellow ones here are considered less typical or less common with COVID-19. Most common would be fever, fatigue, aching muscles, shortness of breath, and cough. Even though loss of taste or smell is not common in people with COVID-19, it's very specific for COVID-19. So if somebody has that, until proven otherwise, you should assume that that person has COVID, because it's such a very specific thing that, and a very unusual thing for respiratory illnesses to just have a loss of taste or smell without any other symptoms. Headache, phlegm buildup, so that could be runny nose, stuffy nose, and then diarrhea. Those can also happen. If anybody has any one of these symptoms, that should be considered suspicious for COVID during the middle of this outbreak that we are in. If somebody is asymptomatic, but they are a close contact of somebody who has COVID, they should get tested. And I'll talk through what close contact is defined as. Those asymptomatic close contacts, we want to test 5 to 7 days after exposure. If you test earlier than 5 days, there's a higher possibility of false negatives. So somebody who comes up negative, but they actually will develop COVID, will develop that infectious period that could be contagious to other people. If you test too late, then you also can have false negatives, but you may also miss that window where you can narrow the scope of who gets exposed to this. An asymptomatic household contact, so anybody who's in the household, you want to test at baseline, so as soon as you know that that first person is positive, and then also 1 week later. And the rationale for that is that there may be asymptomatic people in the household who actually infected that index person. So the person, shows up with stuffy nose and everybody else in the house is fine. Well, maybe somebody else in the household actually was their asymptomatic contact that exposed them in the first place. So if we can identify those people, we can do a little bit better job of contact tracing to those other contacts outside of the home. And then the other reason that somebody might get tested is before surgical or other high-risk procedures. A lower priority test would be somebody who has a non-specific exposure. Maybe they were at a large event, or they heard that somebody they know has COVID, but they don't know when they were infectious, or they were around somebody a week before they got tested, or something like that, something that doesn't really fit into this, the category of that contact tracing. Or they say they just want to be safe, or they maybe want to go to a party this weekend or a Thanksgiving gathering or something like that, and they want to get tested ahead of time. That's really most appropriate for those community test sites. If people want to get tested that way, that's fine. But our limited resources, we want to really focus in on those ways that we're going to kind of stop the spread, which is by testing those symptomatic people and then those asymptomatic close contacts or household contacts. So close contact is defined as somebody who is within 6 feet for at least 15 minutes, and that's cumulative over a 24-hour period. So if you have a 5-minute conversation with somebody in the morning, 5 minutes at lunch, 5 minutes in the afternoon before you go home from work, that counts as 15 minutes if you're within 6 feet of that person.
Even if they're masked?
I'll go through that at the end. So yes, masking does not change contact tracing, which it does help with the risk. So it does reduce your risk, but it does not change contact tracing. If you have any physical contact between two people, so a handshake, a hug, people who are at wrestling practice together, even if they were just practicing together for 5 minutes, but they had physical contact, that counts as a close contact. Any contact with respiratory secretions. So if you are a teacher and you've got a 4-year-old in your classroom who sneezes on you, or you have to help them wipe their nose or things like that, that counts as close contact, even if you don't have that 15 minutes cumulative. And then a household contact is if you live in the same household, and we don't look at the 15 minutes cumulative time, because living in the same household is considered so much higher risk for being exposed to that person's respiratory secretions, sharing kitchens, sharing bathrooms, things like that. Or if you stayed overnight for at least one night in the same house, that counts as well. So if we do test one of those people that fell into one of those categories and they are positive, what do we do with that? So if they have no symptoms at all, we want them to isolate for 10 days after their test date. So 10 days after they test positive, they will be released from isolation. They can go back to normal activities. If they're symptomatic, so if they have any of those COVID symptoms, we would isolate for 10 days after the onset of symptoms. So if they have a cough or sore throat on a Thursday, they get tested on Friday, we would start their 10 days on that Thursday, not the Friday. If the symptoms are vague or uncertain though, so some people will call and say, yeah, I've had a stuffy nose for 3 months, or well, I had a fever, but then that went away, but then I got body aches, and then I got tested. To be safe on something like that, where it's vague or uncertain, we isolate from 10 days from the test date, because that's kind of the most cautious way to go about. So if the test date is kind of the middle of those symptoms, then we would start it on the day of that test date. If they're tested for exposure, so say I have a coworker who was positive, I get tested, I don't have any symptoms at all at the time that I get tested, but then 3 days later I get sore throat, cough, fever, then we would actually change their isolation date to 10 days after the onset of symptoms. And the reason for that is that we may be catching them on the very early end of those symptoms if we're testing earlier when they're asymptomatic. And so we need to bump it back a little bit longer to make sure that we're catching that entire infectious period. So infectious period is considered onset of symptoms plus 10 days, or positive test date plus 10 days if no symptoms at all. Is that clear? That gets a little bit confusing, I think, for some people.
Doesn't look like we have any questions coming in.
So if somebody is positive, when we are counseling them about what to do with that result, we want to make sure that they're isolating, but then we also want to make sure that we're testing their contacts. So household contacts, we want to test at baseline, and then also about a week later. Close contacts, you would track back to 2 days prior to the test date. So if somebody has no symptoms at all, they get tested on a Friday, we would go back to Wednesday to do contact tracing for them. So those would be those people we would identify who had that 15-minute of exposure, or any physical contact, anything like that. We would go 2 days prior to that test date if they're asymptomatic, or 2 days prior to the onset of symptoms if they are symptomatic. So if they have a sore throat on a Thursday and they get tested on a Friday, we would go back Thursday as the onset, go back to Tuesday for that contact tracing. What to do with results if they're negative. This really depends on why they were tested. So if somebody is tested for symptoms versus exposure, we do something different with that. So if you're tested for exposure, if you're identified as a close contact, you go get tested right in the time period that we recommend that you get tested in, and you're negative, wonderful. You still have to isolate for the entire 14 days after the exposure you had. So 14 days is what we quarantine after somebody has been exposed to somebody with COVID. It's different from the 10 days of isolation that we do for somebody who's confirmed positive, because we know that it can take up to that 14-day period before somebody might develop the illness. The household contacts have to isolate for 14 days after their last exposure during the household member's infectious period. So this I see Jody has a confused look on her face because this is confusing. So if I were exposed as a household contact to my child, say my 12-year-old had COVID confirmed, they would have their 10-day isolation period. They're infectious for that entire 10-day isolation period. So we have to consider any exposure to them during that time that you could potentially get exposed during that time. So once they've finished their isolation period, then no more exposure from that person. Now you can start your 14 days of monitoring, because at any point I could have been exposed on day 1, I could have been exposed on day 10, and I need to count 14 days from that last exposure to that person. If you are able to completely isolate and have no exposure to that person during their infectious period, then you would count your isolation from the last exposure to that person during that infectious period. So if I say, okay, you're going in the basement, you're not coming back up, we're going to bring you your meals, you use the bathroom down there, and we have no contact at all, then I can go back to, okay, we started that on day 1 of their isolation. Now I only have to count 14 days from that exposure.
Okay,
Does that make sense?
it does.
It gets very complicated when you have multiple family members that then test positive. So say you have a parent who tests positive, 5 days later, their child tests positive. 5 days after that, their other parent tests positive. What do you do with all the other kids in the house? They really have to, if you're not isolated from those people, you do have to count that 14 days starts over and doesn't really start until the end of that isolation period for those infectious people. It's a very long time.
Wow.
If somebody is quarantining, so say they were tested, they were negative, they were tested because of exposure, but then they later develop symptoms, they have to be retested. So at any point during a quarantine period, if somebody develops symptoms, they should be retested, because it is possible to not develop symptoms until the very end of that quarantine period. So we need to make sure that we're watching for those symptoms and testing if they arise. Okay, so again, going back to somebody has a negative test result, what do you do with that result? If they were tested because of symptoms, they had any of those symptoms that are high risk for COVID, no exposure here. So say no exposure, tested for symptoms. If it's negative, if you were tested too early in the course or it wasn't an adequate sample, it still is possible. It could be a false negative. So we recommend that people continue to isolate until symptoms are improving and fever-free for at least 72 hours. But by the time you call them with their result, if they say, oh, I feel so much better, I haven't had any symptoms for the last 3 days, they can go back to work or school immediately if they were only tested for symptoms. If they had that exposure, the negative test does not change that quarantine period. But if they're tested for symptoms, they have a runny nose, they have a sore throat, they get tested. If they're negative and they're improving, they can go back to normal activities without more isolation. That sound clear?
Yep.
Okay, so I have a couple scenarios and that might help to illustrate some of this. So Joe works in an office, has a coworker who tests positive. This coworker shares an office with him and they have lunch together every day. The coworker developed symptoms on a Thursday night, got tested on a Friday and was positive. So Joe should quarantine for at least 14 days from that last exposure to his coworker. But Joe, while he's quarantining, his household contacts do not need to quarantine at this point because he hasn't tested positive. He doesn't have any symptoms. All of those household contacts, it's like a friend of a friend. If you don't have that direct exposure to that person, you do not need to quarantine. Joe should get tested 5 to 7 days after exposure, which for him would be the Wednesday and Thursday that he worked with the positive person. So if that person developed symptoms on a Thursday night, got tested on a Friday, you'd go back Wednesday, Thursday, and count the exposure starting at that time. So Joe gets tested as instructed and he tests positive. So he should now isolate for 10 days after that positive test, or if he got tested and had some symptoms, then 10 days from that onset of symptoms. Once he tests positive, all of his household contacts now are considered household contacts of a positive. So they would all quarantine and then they would get tested based on that household contact recommendation. Joe's wife is a teacher. So this household contact is a teacher, and they have two children who are active in high school sports. So we've got lots of potential contacts here.
Oh boy.
Joe's wife gets tested at baseline. So as soon as we know that Joe is positive, we test his wife and she's negative. She gets tested 1 week later and is positive. She's then going to isolate for 10 days after that positive test, or if she had symptoms, 10 days after the onset of symptoms. If she's been quarantining as she was instructed, then no contacts would need to be tested or traced because she has not been outside of the home. There's nobody else that would have been exposed to her during that infectious period. Joe's daughter has no symptoms. She gets tested at baseline and is positive. So for her, that baseline test, we'd count back 2 days prior to that because she's asymptomatic. So all we have to go on is a test to know the onset. So we test her at baseline, she's positive. We'd contact trace back to 2 days prior to that positive test. So during those 2 days, she had a volleyball game and an in-school day. So all the people that she came in contact during that volleyball game and in-school day would then be instructed to quarantine and potentially test 5 to 7 days later. So the goal here is so if we had not tested Joe's daughter, we wouldn't know that those people had been exposed, right? So she was maybe the asymptomatic source for Joe getting, or maybe she was positive even though Joe hadn't been positive. Maybe there's two separate things going on. He got it from his coworker, but also his daughter was positive. Or maybe we're just catching it at the very early end of this, but we still have to go 2 days prior to that to make sure that those contacts are then quarantining. Because look at all the people that could have been exposed if we hadn't tested her.
And are those exposures the 15 minutes?
That's the 15 minutes, but there are some interactions that are hard to judge that 15 minutes on. Right. So depending on the age of the child and the kinds of activities that they're in, sometimes this might be a whole classroom, sometimes this might be a small cohort of kids or her volleyball team. It really depends, so that the health department gets involved in that and really helps to decide that because it gets very complicated. Okay, Joe's son has no symptoms. He gets tested at baseline. He's negative. Tests again 7 days later, still negative. However, because Joe's wife got tested 1 week after he did and was positive at that point, we can't start Joe's son's quarantine of 14 days until Joe's wife is done with her isolation period. So he would be at home this whole time because he's a close contact of Joe. But then we wouldn't start that 14-day quarantine final period until that last exposure to Joe or Joe's wife or Joe's daughter during their infectious period. If that son can totally isolate from everybody who's positive in the house, separate bathrooms, separate eating space, things like that, then that would start their 14-day quarantine at that point. So Joe's son could potentially be out of activities for longer than a month, depending on how this all plays out with exposures and isolation. Yeah. Okay, another scenario, Susan works as an RN in a nursing home. She lives alone. She also cares for her 92-year-old grandmother on the weekends. Susan is screened at work every week and tests positive. The day after getting tested, she develops loss of taste and smell. So normally we would start that 10-day isolation period on the day of the test if you're asymptomatic, but because she developed loss of taste and smell, it would actually be the day that she developed symptoms that would start her 10-day period. We would contact trace back to 2 days prior to that positive test. If she had seen her grandmother in the 2 days prior to the testing, then we would test that grandmother 5 to 7 days after that exposure, or if she develops any symptoms. Susan should not return to work until at least 10 days after onset of symptoms, at least. If she's still got symptoms at that point, then it has to be a discussion with the nursing home and with public health about whether she's ready to go back. And if grandmother's test is negative, the grandmother should still be quarantined for 14 days after that last exposure to Susan. Okay, so this gets at your question, Jody. Things that affect contact tracing. The amount of time somebody has spent with the person who's positive, the amount of distance between the people, whether there was any physical contact, when the contact occurred with relation to the symptoms or positive test. So if it was 5 days before symptom onset, that person would not be included as a contact. If it's 2 days before, then they would. Whether the person exposed has recently had confirmed COVID. So if I had confirmed COVID a month ago and I recovered and I'm totally back to normal and I'm asymptomatic and I get exposed again to a close contact, I don't have to quarantine because it's been less than 90 days since my recent infection. If I were to develop symptoms though, I should get retested for COVID to make sure that I don't have an active infection. But we generally do not retest and we don't quarantine if somebody has that recent infection with COVID, because we know that there's at least some short-term immunity. The only masking that affects contact tracing is healthcare workers' appropriate use of PPE. So healthcare workers that have been trained in using surgical level masks and eye protection, if they get exposed to somebody who has COVID and have that close contact by definition of the physical contact or less than 6 feet or contact with respiratory secretions, as long as they are appropriately using their PPE at the time of the exposure, they do not need to quarantine. Things that do not affect contact tracing, whether people wore masks in a community setting, whether they were indoors or outdoors, whether there was a plexiglass shield, whether the person was asymptomatic during the time of contact, or whether the people had had negative tests previously. So I, test negative on a Thursday, and I'm around you, and then I test positive on a Friday. It doesn't matter that I had that negative test a day ago. It only matters that I have a positive test now. However, we do know that some of those things that even though they don't affect contact tracing, they may affect risk. So it does help as people are kind of thinking about what activities to do to think about what affects risk. So things that are less risky over here on the left side, things that are more risky over here on the right side. Less risk is outdoors, more risk would be indoors. Less risk is if people are wearing masks, more risk would be no masks. Less risk, greater than 6 feet of distance between people, more risk, less than 6 feet of distance between people. Less risk would be fewer people at a gathering, more risk, more people at a gathering. And less risk, low local levels of COVID, more risk, high local levels of COVID. We can't ever say zero risk. So even though these things decrease the risk, they don't guarantee anything. So people can still be exposed even if they're trying to be careful. But if people are doing all of these things, the risk is much, much lower. And if people are doing more of these things, the risk is much, much higher. There is this risk calculator. I'm going to try to click on it and see if this comes up. So this is a risk calculator based on number of people at a gathering. It drills down to county levels of disease. So if we go to Iowa County, if we have an event of 50 people in Iowa County right now, there's a 97% chance that one of those people at the event has COVID.
Wow.
Okay. If we even go down as far as 10 people, if we drill down to Iowa County, it's about a 50-50 chance that one of those people out of 10 has COVID. So when people are thinking about their plans for Thanksgiving or Christmas, even if they say it's just going to be small, it's just going to be about 10 people, there's about a 50-50 chance that one of those people will have COVID. So that has to be considered as people are thinking about their risk. That's all I have in terms of the information I want to present, but I do need to give a big thank you to all of the people who have helped to make the testing, contact tracing results and care for COVID patients go as smoothly as it has since March, since we started with this. So that includes the COVID line staff, COVID testers, patient care staff that are caring for COVID patients, clinic staff that are calling with results, housekeeping staff that are helping to keep our areas safe, the infection control and HR team that are helping to decide when people can go back to work if they've had an exposure, and then schedulers, receptionists, everybody who's had to deal with increased level of complexity of their job as we're trying to navigate this. And it's really been, it's been something that we as an incident command team have been thinking about on a very minute basis, daily basis since March, and everybody else just gets kind of thrown into there and moved around as we see fit. So we really appreciate everybody working so hard on this and being flexible and being careful and really trying to take care of patients as well as we can.
I echo that. We've got an incredible staff and people have really come together. We have one question. Please clarify one more time the infectious period. If my symptoms last longer, like 2 to 3 weeks, am I still not infectious after 10 days?
Yeah, that's a good question. So if people have mild symptoms, so some people can have lingering symptoms for quite some time. So if people have mild symptoms, if they're not hospitalized, if they don't require oxygen for respiratory distress, things like that, then we consider that 10-day period to be the 10-day period. If people continue to have fevers, severe respiratory distress, severe coughing, then there are some recommendations to stretch that out to 20 days. To be cautious, but that's really primarily for people who have moderate or severe illness, not for people who have mild symptoms. So some people have loss of taste or smell for months. Some people have, congestion or mild headaches or fatigue or feeling winded when they go upstairs. That can last months afterwards. That's not their infectious period. The infectious period is really those acute symptoms and any fevers. So if somebody at the 10-day mark says, yeah, my sore throat is getting a little bit better, nothing's getting any worse, I haven't had any fevers, then they're considered done with their isolation period.
Okay, got it. We have another one that came in. As someone who calls patients with results from the clinic, accurate phone numbers are critical. It's time consuming and delays advising when the number isn't accurate to try to locate the correct number. It's extremely beneficial when patients are MyChart active also. We have limited staff calling every day, and we call over 100 patients in between scheduled clinic patients. So I imagine that is the patient themselves providing that callback number. Also, anyone who's entering information in their chart.
Yes, yep. So that's really the number that is in, if somebody is one of our patients already, the numbers that are in the Epic chart are typically used primarily, but everybody who gets tested for COVID, regardless of where they get tested, they provide a phone number in those forms, and that is either then entered into Epic for those who are not our patients or used by the community test sites to call the people. So if people get a phone call on that line, really important for them to answer that when they get it, because there are a lot of people who see an unknown number that may be your COVID result that's coming back. So making sure people are answering that is helpful. And then really entering in those numbers when people get screened. That's something that unfortunately our COVID test site being so busy, if people are not writing legibly on that form, or something gets entered in the wrong way, then sometimes that can be a challenge. So
from a community education standpoint, are the callers able to leave a message if you don't pick up your phone? That's kind of a tricky area, isn't it?
We can only leave a message with results or a detailed message saying who we are and why we're calling if they have a personalized voicemail.
Okay.
So if it just says, this number cannot be reached, please leave a voicemail, we cannot leave a detailed voicemail message with that.
Okay, that is good to know. So that'll help on the community education side of our effort. Good point. Thanks, Ashley.
Any other questions that came through?
I'm not seeing any more. Nope. All right. So Are you done with your slide?
Yes, done with my slides. So I really appreciate everybody's work, and please reach out if you do have questions, but just wanted to provide a little overview because I know that it gets complicated and there are a million different scenarios for how people might have gotten exposed, what kind of contact they had, and what they need to do for moving forward. So it's really, this was just meant to be kind of an overview, but it does get complicated. Please reach out if you have any questions about it.
Great. Thank you very much for your time. This has been really eye-opening for someone who's not on the patient care side of things. So thank you so much. Again, if you're watching this as the recorded version, if you have any questions at all, please just send an email to info@uplandhillshealth.org, and we will get those answered as quickly as we can as those come in. So thank you very much. And we're
Thank
going to
you.
sign off.
All right, bye.